Give the Amnesiac kernel to the rookie. Nurse Beth Lang said it loudly enough for the entire neurological station to hear. A few heads lifted from their computers. One resident hid a smile behind a paper cup. Another turned slightly in his chair so he could see room 12 through the glass. Claire Rowan stood at the end of the counter, reviewing the same 3 pages for the second time. It was her 6th shift at Liberty Harbor Military Medical Center. Long enough for the staff to decide she was quiet. Not long enough for anyone to ask why her personnel file listed 9 years of military medical service, but almost no operational details. Beth placed a tablet beside Claire's hand. Colonel Ethan Calder, 46, Delta Force. Blast exposure during a training operation 12 days ago. No major hemorrhage, no skull fracture, no surgery. He remembers old missions, weapon systems, and classified codes, but he forgets where he is every 10 minutes. 7 minutes this morning, a nurse corrected. Beth shrugged. Even better. What happens when he forgets? Claire asked. He pulls off his identification band, accuses the staff of holding him prisoner, and tries to leave. Does anyone orient him before approaching? We tell him where he is. Once? Beth gave her a tired look. As many times as necessary. A young neurology resident named Peter Collins had his phone angled toward the room. The camera was already open. Dr. Julian Harlow stepped out of the physician's workroom carrying Ethan's chart. He was the director of neurology, silver-haired, precise, and respected enough that disagreement around him usually became silence. Colonel Calder is scheduled for psychiatric transfer this afternoon, Harlow said. Your task is to keep him calm until transport arrives. Claire looked up. Why psychiatric? Severe post-traumatic amnesia, agitation, dissociative behavior, and difficulty accepting the extent of his neurological injury. Is the memory loss stable? Harlow paused. No. How quickly is it worsening? The interval between resets has shortened. Then why is he being transferred away from neurology? Because his imaging shows no treatable structural lesion. Post-traumatic amnesia can fluctuate. Fluctuation and progression are not the same thing. Beth smiled without humor. There she goes. Harlow closed the chart. The CT was negative. The MRI showed bilateral signal changes consistent with traumatic injury. Neuropsychology has already documented impaired memory formation. Did the MRI include venography? No indication for it. Did anyone listen to the pulsing sound he reports? Harlow's expression cooled. He reports many things during confused periods. Claire picked up the tablet. Confused patients can still describe symptoms. Room 12 was too bright. Every ceiling light was on. A television played a news channel with the sound muted. 3 staff members stood near the bed, all speaking at once. Ethan Calder sat upright with his back against the wall instead of the pillows. He was powerfully built, with short dark hair graying at the temples, and a bruised cut above his left eyebrow. His hospital wristband lay torn on the floor. Both hands were open in front of him, prepared to defend himself. A resident held another identification band. Colonel, your name is Ethan Calder, the resident said. Ethan's eyes sharpened. That is what you keep saying. It is written in your record. Records can be changed. You are at Liberty Harbor Military Medical Center. I do not know this building. You were injured during a training exercise. I do not remember a training exercise. The resident stepped closer with the wristband. Ethan moved first. He seized the resident's forearm, twisted it down, and forced him against the side of the bed with the speed of someone whose body still remembered everything his mind could not. Security entered. Claire stopped in the doorway. Turn off the television. No one responded. She crossed to the wall and switched it off herself. Then she dimmed half the overhead lights. The room became quieter before anyone stopped speaking. Everyone except one security officer steps outside, Claire said. Beth frowned. He just attacked a resident. He defended himself against a stranger trying to restrain him. He has already been told who we are. And he no longer remembers. Harlow appeared behind her. Claire, de-escalate him. She did not approach Ethan. Instead, she stood 8 feet away, with both hands visible. My name is Claire Rowan. I am a nurse. I am standing near the door. I will not touch you. Ethan kept the resident pinned. Claire's voice remained calm. Do not chase what you forgot. Tell me the last thing you know is true. Ethan froze. The resident stopped struggling. The words moved through the room like a code no one else understood. Claire felt them leave her mouth before she realized she had chosen them. A dark transport aircraft. Emergency red lights. A man beneath fractured concrete asking the same question every 4 minutes. Who am I? Where are we? Why can't I remember? Ethan slowly released the resident. His eyes found Claire's face. For the first time since she entered, he looked less confused than everyone around him. Ghost, he said. No one moved. Claire had not heard that name in 9 years. Ghost belonged to black flight gear, respirators, and missions without official locations. It belonged to patients who had never seen her face. It belonged to a version of Claire erased from every public record after 2 members of her evacuation crew died in a crash. She survived. Ethan stepped away from the bed. You're alive. Claire's pulse changed. Harlow looked between them. You know this patient? Claire kept her attention on Ethan. I do not recognize him. He recognized you. He recognized something I said. Peter Collins lowered his phone slightly. Claire noticed. Stop recording. Peter pushed the phone toward his pocket. I wasn't recording. Open the screen. Harlow held out his hand. The resident surrendered the device. The video showed Ethan restraining the first doctor, Claire entering, and the exact moment he said ghost. Harlow deleted the recording and looked at Peter. Leave the unit. Peter left without arguing. Before we continue, welcome to Emergency Legends Archive. If you enjoy stories about hidden military heroes, impossible diagnoses, and the moment one person finally listens, subscribe, leave a like, and tell us where you are listening from. Ethan continued staring at Claire. Where did we meet? She asked. His certainty weakened. He looked around the room. The glass walls, the bed, the doctors. His breathing accelerated. Who are you? The recognition was gone. It had lasted less than a minute. Claire did not react with surprise. She took a blank index card from the counter and wrote 5 lines in large block letters. Your name is Ethan Calder. You are at Liberty Harbor Medical Center. A blast injured you 12 days ago. Claire Rowan is your nurse. Next, a neurological examination. She placed the card on the bedside table within his view. You do not have to believe me immediately. Read the card, then tell me the last thing you know is true. Ethan read it twice. My name is Ethan Calder. That is one true thing. I am in a hospital. Second true thing. You say you are my nurse. Yes. He looked at her hands. You called yourself Claire. I did. Why did I call you Ghost? I do not know yet. The answer unsettled him less than a lie would have. Claire sat in a chair several feet away. I will ask questions about what you can do now. I will not test you by embarrassing you. Harlow remained near the door. Beth stood behind him with the torn wristband in her hand. Claire began with basic orientation. What year is it? Ethan gave the correct year. What month? Correct. What city? He looked at the card. Norfolk. Good. Do you know your rank? Colonel. Your unit? His expression hardened. You do not have clearance. His operational judgment remained intact. Fair answer. She showed him 3 ordinary objects, a key, a pen, and a coin. Remember these. I will ask again later. Ethan nodded. Claire tested his strength, eye movements, and speech. Everything appeared normal. Then she asked him to explain how to clear a malfunction in a rifle. He answered immediately, giving the steps in precise order. Now repeat the 3 objects. He looked at her. What objects? Key, pen, and coin. I have never seen them. Only 90 seconds had passed. Naomi Bell, the neuropsychologist, arrived carrying a testing kit. She watched the exchange without interrupting. Claire asked Ethan to copy a complex hand movement. He performed it perfectly. She repeated the movement 3 times. He improved each time, even though after 2 minutes he denied having practiced it. Naomi noticed. Procedural learning is functioning, she said, but conscious recall is not, Claire replied. Ethan read the orientation card again. My name is Ethan Calder. Yes. How long have I been here? 12 days since the blast. 4 days at this hospital. Do I have family? Claire looked toward Harlow. He answered. A daughter. Ethan's face changed. What is her name? Harlow hesitated. Claire checked the chart. Sophie. Ethan repeated it. Sophie. The name carried no recognition. His body knew how to assess a threat, protect classified information, and disarm a man. He could not remember his daughter. Claire watched his expression tighten. Do not force the memory. She is my daughter. Yes. I should know her. You know she matters. That is true even if the name is not available yet. Ethan pressed both hands against his temples. Headache? Claire asked. Yes. Where? Behind the right ear. Then everywhere. Does it change with position? Worse when I lie down. Any sound with it? He looked toward the corner of the room, listening. A machine. Claire turned off the infusion pump temporarily. Still there? Yes. What kind of sound? My heartbeat. In your ear? Inside my head. Harlow said. Pulsatile tinnitus can follow blast exposure. Claire stepped closer. May I listen behind your ear? Ethan looked at the card. You are Claire. Yes. My nurse. Yes. He nodded. Claire placed the stethoscope behind his right ear. At first, she heard only his pulse. Then beneath it came a faint rushing sound. Continuous, mechanical, blood moving where it should not move at that pressure. She shifted the stethoscope toward his temple. The sound grew louder. Beth watched her expression. What is it? A brute. Harlow approached. Superficial vascular noise after trauma is not unusual. Neither is it something to ignore in a patient with worsening memory. Claire looked closely at Ethan's right temple. Several superficial veins appeared more visible than on the left. Were those present before the injury? Harlow checked earlier photographs. Not documented. Ethan suddenly looked at Claire. Who are you? The reset had happened again. This time after 6 minutes. She pointed to the card. He read each line. My name is Ethan Calder. Yes. You are Claire Rowan. Yes. Why do I know the name Ghost? We are trying to understand that. He nodded, trusting the structure even when he could not trust his memory. Then his gaze stopped. Not shifted. Stopped. His eyes fixed on a point beyond Claire's shoulder. Ethan? No response. His left hand began to tremble. Small, rhythmic movements traveled from his fingers into his wrist. Naomi stepped forward. Possible focal seizure. Claire cleared the space around him without forcing him flat. Do not restrain the arm. Time the episode. Ethan's jaw tightened. His eyes deviated slightly to the right. The tremor lasted 21 seconds. When it stopped, he inhaled sharply and looked around the room with complete fear. Where am I? Claire held the orientation card in front of him. Read the first line. He stared at the words. His lips moved, but he did not understand them immediately. The ability returned slowly. My name is Ethan Calder. That is the last true thing. He looked at her. Ghost? The recognition returned for only a heartbeat. Then faded again. Claire faced Harlow. The intervals are shortening. He has positional headaches, pulsatile tinnitus, dilated temporal veins, and focal seizures. The MRI changes are bilateral and centered around structures that form memory. Post-traumatic edema can produce all of those findings. Not this pattern. You have not proved a vascular cause. No, Claire said. But his memories are not disappearing. She looked at Ethan, already reading the same 5 facts for the 4th time. Something is drowning them. The seizure ended before the emergency medication reached the room. Ethan remained seated on the edge of the bed, breathing hard. His left hand still curled against his thigh. Claire kept the orientation card where he could see it, and waited until his eyes began moving normally again. Doctor. Julian Harlow checked his pupils and strength. Colonel, lift both arms. Ethan raised them. The left lagged behind by less than a second. Hold them there. Both remained elevated. Harlow looked toward Claire. No persistent deficit. He had a focal seizure and transient weakness. He had a brief episode after traumatic brain injury. The distinction matters only if we know the cause. Harlow turned to the nurse preparing medication. Load levetiracetam. Continuous EEG. Repeat electrolytes. Claire asked, and vascular imaging? Not yet. The brood is still present. So is the blast history. Claire looked toward Ethan. He was reading the card again, lips moving over each line as if assembling himself from the words. My name is Ethan Calder, he said. That is true, Claire replied. You are Claire Rowan. Yes. I had a seizure. Yes. His eyes sharpened. How long ago? Less than 2 minutes. He looked down at his left hand. I do not remember it. I know. Naomi Bell pulled a chair beside the bed. Colonel Calder, I am Dr. Naomi Bell, a neuropsychologist. I want to understand which kinds of memory are working and which are not. Ethan looked at Claire. She is part of your medical team, Claire said. You can stop the evaluation at any time. He nodded. Claire changed the room before the testing began. She placed a large digital clock on the wall opposite the bed. Beneath it, she taped a sheet containing the date, hospital name, and names of the primary staff. A second card remained in Ethan's hand. On the bedside table, she opened a blank notebook. The first page read, My name is Ethan Calder. This notebook belongs to me. Read the most recent entry first. She added the time and wrote, 4:18 p.m. I had a short seizure. I am safe. Claire and Dr. Bell are with me. Ethan watched her. You expect me to forget this conversation? Yes. How soon? We are measuring that. That is not an answer. No, it is the honest one. He accepted the notebook. Naomi began without asking him to remember a list. She showed him a sequence of hand movements across the table. Ethan copied them immediately. She changed the sequence. He repeated it. On the 5th attempt, his speed improved. Then Naomi waited 3 minutes and asked, Have we done this before? Ethan looked at her hands. No. Show me the movement anyway. He performed the full sequence without hesitation. Naomi looked at Claire. Learning without conscious recall. Procedural memory remains intact, Claire said. Naomi placed a metal puzzle in front of him. Ethan solved it in 40 seconds. 10 minutes later, he denied seeing it before, but completed it in 12. She played several seconds of an old military cadence. Ethan identified it. She showed him insignia from units he had worked with years earlier. He recognized each one. When she placed a photograph of his daughter Sophie on the table, his expression changed before he read the name written beneath it. Do you know her? Naomi asked. Ethan stared at the photograph. No. Does looking at her make you feel anything? His jaw tightened. Like I am supposed to protect her. That matters. It is not enough. No, Naomi said. But it means the emotional connection is still present, even when the personal details are inaccessible. Ethan touched the edge of the photograph. She is my daughter? Claire pointed toward the orientation sheet. Yes. Her name is Sophie. He repeated the name several times, then wrote it in the notebook. 5 minutes later, he looked at the same photograph and asked who she was. Claire answered again. She did not soften the repetition or pretend it was the first time. She gave him the same facts in the same order. Your name is Ethan Calder. She is Sophie Calder. She is your daughter. You are safe in Liberty Harbor Medical Center. Ethan looked at her. How many times have I asked? 4 today since I met you. His face hardened with shame. Claire placed one hand over the notebook, not touching him. The repetition is a symptom, not a failure. He looked toward the clock. What is the last true thing? You asked about Sophie. You wrote her name down. That happened at 4:27. Ethan read the entry. His breathing slowed. Beth Lang watched from the doorway. He has been calmer for almost an hour. He has not been forced to guess, Claire said. We asked basic orientation questions. You tested him every time he woke. Imagine opening your eyes, knowing something is wrong, and having strangers ask you to prove who you are before explaining anything. Beth looked at the cards taped around the room. We thought repetition would help anchor him. Repetition helps when it is information, not when it is an examination he keeps failing. Harlow entered during the next testing block. EEG shows intermittent right temporal slowing, no continuous seizure activity. Naomi closed her folder. His pattern is highly specific. Remote memory is inconsistent but available. Procedural learning is strong. Emotional familiarity is present. New declarative memory formation is severely impaired. Consistent with bilateral hippocampal injury, Harlow said. Possibly, Naomi replied. But the worsening interval concerns me. Harlow looked at the clock. How short? Claire checked her notes. The longest stable period this afternoon was 11 minutes. The shortest was 4. Fatigue shortens attention. He is not simply losing attention. He is failing to retain completed events. Ethan looked up from the notebook. Who is he? Claire pointed toward the wall sheet. Dr. Julian Harlow, Director of Neurology. Harlow approached slowly. Colonel Calder, I am responsible for your neurological care. Ethan studied his face. Have we met? Yes. How many times? Harlow hesitated. Claire answered. At least 6 today. Ethan looked back at the notebook. The most recent entry confirmed it. He pressed his fingers against the right side of his head. Claire noticed. Headache increasing? Yes. Rate it from 0 to 10. 7. Better sitting or lying down? Sitting. Does coughing change it? He coughed once. His face tightened immediately. Worse, he said. Any nausea? Yes. The pulsing sound? He pointed behind his right ear. Louder. Claire took the stethoscope again. May I listen? He checked the card. You are Claire Rowan. Yes. He nodded. The brute remained. A rushing, rhythmic sound traveled from behind the ear toward the temple. It did not resemble an ordinary heart murmur conducted through tissue. It sounded localized and continuous between beats. Naomi listened next. Her expression changed. Harlow accepted the stethoscope reluctantly. He placed it behind Ethan's ear. For several seconds, the room remained silent. Then Harlow removed it. There is vascular noise. Claire folded her arms. That is what I said. It may still be benign. With worsening positional headache, seizures, dilated veins, and bilateral deep brain abnormalities. Harlow looked toward the MRI on the wall monitor. The signal changes were interpreted as traumatic edema, centered in both hippocampi and extending toward the thalami, Claire said. The blast was not symmetrical. Diffuse pressure waves can create bilateral injury. Then why is he worsening after 12 days? Harlow did not answer immediately. Naomi said, he also has no documented period of prolonged hypoxia, no cardiac arrest, and no major hypotension. The imaging pattern is difficult to explain with oxygen deprivation, Claire added. And his symptoms worsen when he lies flat, when venous pressure would rise. Harlow looked at Ethan. The colonel had begun reading the notebook again. The same pages, the same facts. His reset had occurred without anyone noticing. My name is Ethan Calder, he said quietly. Claire turned toward him. Yes. What happened to me? A blast injured you 12 days ago. Why can't I remember? We are still finding the cause. He pressed his hands against his temples. The machine sound is back. There is no machine running. I know. That answer frightened Harlow more than confusion would have. Claire pointed toward the bed. Stay seated. Do not lie flat. She checked the superficial veins near Ethan's right temple. They appeared more prominent than earlier, especially when he bent forward. Have radiology compare these veins with his admission photographs, she said. Harlow sighed. I will order an MR angiogram. And venography. An arterial study first. The problem may be on the drainage side. We do not order every possible sequence because one nurse has a theory. Claire met his eyes. No. We order it because the patient has a brute, positional symptoms, progressive amnesia, seizures, and a deep symmetrical imaging pattern that your diagnosis does not explain. Naomi spoke before Harlow could answer. I support venous imaging. Beth added quietly. So do I. Harlow looked around the room and realized the resistance had shifted. Full MRI with arterial and venous sequences, he said. Urgent, not emergent. Claire turned toward Ethan. He had stopped following the conversation. His eyes were fixed on his own reflection in the dark screen of the television. Ethan? He raised one hand toward the reflection. Who is that? Claire moved beside him without touching. That is you. He stared at the glass. No. Your name is Ethan Calder. The man in the reflection moved when he moved, but there was no recognition in his face. Claire handed him the orientation card. He looked at the first line. The words seemed unfamiliar. Read it aloud, she said. His lips moved. No sound came at first. Then the letters connected. My name is Ethan Calder. That is true. He looked at Claire. Are you Ghost? I am Claire Rowan. That was not my question. She paused. The room waited. I was called Ghost once. The fear in Ethan's face eased before the facts reached conscious memory. Naomi watched closely. Emotional recognition again. Ethan looked down at the notebook. Did you write this? Some of it. You wrote the rest. He turned the pages. Several lines were in his own handwriting. Sophie is my daughter. The sound is blood. Ghost is alive. He did not remember writing any of them. A transport technician arrived for MRI. Claire explained the scan before Ethan could become alarmed. She added a new entry to the notebook. 5:06 p.m. You are going to MRI. Claire will speak to you through the intercom. The machine is loud. You are not a prisoner. Ethan read it twice, then closed the notebook against his chest. Inside the scanner, the first ordinary sequences again showed no large hemorrhage or mass. The hippocampi remained swollen. Both thalami appeared subtly abnormal. The arterial images looked nearly normal. Then the venous sequence began loading. One deep vein appeared enlarged, then another. Small vessels around the temporal lobes twisted more prominently than they should. Dr. Miriam Shaw entered the control room while the final reconstruction formed on the monitor. She was the interventional neuroradiologist on call, and she studied the images without speaking. Harlow pointed toward the right side. Possible post-traumatic venous asymmetry. Miriam enlarged the region near the transverse and sigmoid sinuses. The flow signal traveled in the wrong direction. She traced the congested veins toward the center of the brain, where both hippocampi and thalami struggled beneath rising pressure. This is not memory loss from impact, she said. Claire looked through the glass at Ethan inside the scanner, holding the orientation card against his chest. Miriam's eyes remained on the abnormal veins. His brain cannot drain. Miriam Shaw did not allow Ethan to leave the scanner. She stood inside the control room with one hand resting against the monitor, following the abnormal vessels from the right side of his skull toward the swollen structures deep inside his brain. The venous reconstruction was incomplete, but it already showed enough to change the direction of his care. Keep him on the table, she said. Add contrast-enhanced venography and high-resolution sequences through the transverse and sigmoid sinuses. Julian Harlow looked at the schedule displayed beside the console. He has already been inside for 40 minutes, and his memory centers have been under abnormal pressure for 12 days. Claire watched Ethan through the glass. He held the orientation card against his chest with both hands. The card told him where he was, who waited outside, and why the machine surrounded him. It did not tell him that blood might be moving backward through his brain. Miriam enlarged the venous image. Normally, blood traveled away from the brain through large channels in the dura, the protective membrane surrounding it. Ethan's right transverse sinus should have carried blood toward the sigmoid sinus and down into the neck. Instead, part of the flow turned inward. Small cortical veins around the temporal lobes had expanded to accept pressure they were never designed to hold. Deeper vessels near the thalami and hippocampi appeared engorged. Harlow leaned closer. Could this be congenital asymmetry? Not with reversed flow. Post-traumatic thrombosis? I do not see an occlusive clot large enough to explain this pattern. Miriam selected another sequence. A bright point appeared near the junction of the right transverse and sigmoid sinuses. There, she said. Claire looked at the screen. What is it? Possibly an abnormal arterial connection. An arteriovenous fistula? A dural arteriovenous fistula. Trauma can create a direct channel between arteries in the dura and a venous sinus. Harlow studied the image. The arterial sequence was nearly normal. These can be fed by small branches that an ordinary MR angiogram does not resolve well. The vein shows the consequence more clearly than the artery shows the source. Claire looked toward Ethan again. The scanner stopped. His eyes opened inside the machine, and his hands tightened around the card. Claire? His voice came through the intercom. I'm here. Where am I? You are inside an MRI scanner at Liberty Harbor Medical Center. Why? We found abnormal blood flow around the parts of your brain that form memory. Silence followed. Then Ethan asked, Have you told me that before? No. This is new. How long will I remember it? Claire looked at Miriam. The doctor did not offer false certainty. Maybe only a few minutes, Claire said. So I will write it down, An answer every time. His fingers loosened around the card. Last true thing? We found something real. Miriam ordered cerebral angiography immediately. Ethan returned to room 12 while the interventional suite was prepared. Claire updated the notebook in large, simple sentences. 6:02 p.m. MRI shows blood draining the wrong way from your brain. Dr. Miriam Shah believes there may be an abnormal connection between an artery and a vein. Next, cerebral angiography. Ethan read the entry twice. Can it be fixed? Miriam thinks it may be treatable. Will my memory return? We do not know yet. He looked at the notebook. Have I asked that already? Once. He wrote beneath Claire's entry. Ask again if I forget. 6 minutes later, he read the sentence in his own handwriting and asked the same question. Claire gave him the same answer. She did not shorten it or allow impatience into her voice. We do not know yet. But correcting the blood flow may give the brain a chance to recover. Naomi Bell examined him again before transport. Ethan could still follow complex instructions and perform learned movements. He correctly identified old military insignia and remembered the procedure for securing a compromised building. When Naomi asked him to remember 3 new words, all 3 disappeared before the transport team arrived. His brain could retrieve an entire tactical framework, learned 20 years earlier. It could not hold a cup, a tree, and a blue door for 3 minutes. Beth Lang stood at the foot of the bed as Claire checked the orientation materials. I called psychiatric transport, Beth said. I canceled the transfer. Claire looked up. Beth continued. The receiving unit asked why. I told them we had evidence of a progressive vascular disorder. We have suspicion. We have enough to know he does not belong in a behavioral transport van. Ethan looked between them. Was I being sent somewhere? Claire opened the notebook to the newest page. The original plan was psychiatric rehabilitation because the memory loss was believed to be permanent after trauma. And now? Now we are investigating abnormal blood flow. He read the line again. Did I agree to that? You agreed during a period when Dr. Bell confirmed you understood the procedure. The consent is documented, and your military medical representative has been contacted. Ethan's expression hardened. Who? Major Amelia Ross. The name triggered a faint response. Not recognition exactly. A sense of significance. I know that name. It is in your file as your designated liaison. He touched the notebook. Write that. Claire added it. The angiography suite was colder than the MRI room. Miriam met Ethan beside the procedure table and spoke directly to him before anyone touched him. Colonel Calder, I am Dr. Miriam Shah. I will place a small catheter through an artery near your wrist and guide it toward the vessels supplying the right side of your skull. Contrast dye will show exactly where the abnormal blood is entering your veins. Ethan checked the orientation card. You are looking for a fistula. Yes. Can it kill me? Yes. Can the test? The risks are smaller, but not zero. Stroke, bleeding, or injury to the artery are possible. Have we had this conversation? Once during consent review. He looked at Claire. She is telling the truth, Claire said. Miriam waited. Do you want to continue? Ethan read the last line in his notebook. I agreed to angiography because my memory is getting worse. He nodded. Continue. Claire remained near his left shoulder while local anesthetic was injected into his wrist. Ethan's memory reset twice during preparation. Each time his heart rate climbed when he saw unfamiliar equipment around him. Each time, Claire returned to the same structure. Your name is Ethan Calder. You are at Liberty Harbor. I am Claire. Dr. Shah is examining the blood vessels around your brain. The next step is already underway. On the third reset, he stared at her face. Ghost. Yes. The single word steadied him faster than the full explanation. Miriam advanced the catheter into the external carotid artery and injected contrast. The first image appeared. Several small arterial branches lit up along the right side of Ethan's skull. Instead of narrowing into normal capillaries, they converged toward a single point in the dura. From there, contrast exploded directly into the venous sinus. Too fast, too forcefully. The high-pressure arterial blood entered the right transverse sigmoid junction and drove backward into veins that should have been draining toward the heart. There is the fistula, Miriam said. Harlow stood behind the protective glass. High grade? Yes. Cortical venous reflux and deep venous drainage. The next injection showed the full route. A branch of the middle meningeal artery fed the abnormal connection. Smaller branches from the occipital artery joined it. Blood surged into the venous sinus, reversed direction, and entered the deep cerebral system. Miriam pointed toward the engorged veins around the hippocampi. That pressure explains the bilateral edema. Claire asked, and the memory resets? The hippocampi cannot function normally while the venous pressure remains this high. The thalamic congestion may also be disrupting attention and awareness. Is the damage permanent? Some of it may be reversible if we close the fistula before venous infarction becomes established. Ethan heard the last sentence. How much time? Miriam answered without looking away from the images. I cannot give you an exact number. Hours? Days? The fact that your symptoms are worsening means the risk is active now. Ethan looked toward Claire. Will I remember this answer? Maybe not, she said. So I'll answer every time. His eyes closed briefly. That sounds familiar. You wrote the same request in your notebook. The diagnostic angiogram continued through additional vessels. Miriam mapped every arterial feeder and the normal veins that would need to remain open during treatment. The fistula was more complex than the MRI suggested. At least 3 small arteries contributed to it. One drained directly into the diseased section of sinus. Another passed close to nerves controlling the face. A third appeared only during delayed imaging. Miriam withdrew the catheter and secured Ethan's wrist. The fistula can be treated endovascularly, she said. We will likely use embolic material to close the arterial connections, but we need to plan the sequence carefully. If we block normal venous drainage while leaving arterial pressure active, the congestion could worsen immediately. Harlow entered after the radiation equipment stopped. I was wrong about the psychiatric transfer, he said. Ethan looked at him. What transfer? Harlow glanced toward Claire. She handed Ethan the notebook and let him read the earlier entry. He looked up again. You believed this was psychological? I believed the trauma had caused permanent memory injury and behavioral deterioration. Behavioral. You became frightened and defensive because you repeatedly woke without context. We interpreted that as resistance. Ethan looked at the catheter dressing on his wrist. You almost sent a man who cannot remember 10 minutes into a locked unit without finding out why. Yes. The direct admission unsettled the room more than an excuse would have. Harlow continued. That transfer is canceled. You remain under neurological and vascular care. Ethan wrote the sentence in his notebook. Before Claire could help him finish, the marker stopped moving, his gaze fixed on the page. The left side of his face tightened. Ethan? Claire said. His right hand began tapping against the bed in a rapid, repetitive rhythm. Naomi moved closer. Focal seizure. The tapping spread into his forearm. Miriam ordered rescue medication. Ethan's eyes remained open, but he did not respond to his name. His head turned slightly to the left, while the muscles in his hand contracted. The seizure lasted 36 seconds. When it ended, he stared at the notebook as though he had never seen written language. Claire pointed to the first line. Read it. His eyes moved across the words. Nothing connected. My name is... Claire began. He looked at her. Fear entered his face. She used the phrase that had reached him before. Do not chase what you forgot. Tell me the last thing you know is true. Ethan grabbed the marker. He could not form a complete sentence. He wrote one word. Ghost. Then again, beneath it. Ghost. A third time. Ghost. Miriam looked toward the post-procedure MRI that had just begun loading on the monitor. A new dark spot appeared beside one of the congested temporal veins. Small, but fresh. A venous leak, she said. Harlow stared at the image. Hemorrhage? Tiny for now. Claire looked at Ethan, still writing the only word his mind could hold. Miriam's voice became quiet. The next vein may not leak. It may rupture. By the time Ethan returned to room 12, the word ghost covered half a page of his notebook. He did not remember writing it. Claire placed the book in front of him and pointed to the newest medical entry beneath the repeated word. 7:11 p.m. The angiogram found an abnormal connection between an artery and a vein around your brain. It is causing high pressure near your memory centers. A small vein has started to bleed. Ethan read the paragraph twice. Can they repair it? Yes. Doctor. Shaw is planning an endovascular procedure. When? As soon as she maps the safest way to close it. Will I remember this conversation? Maybe not. He looked at the word he had written 3 times. Why do I remember Ghost? Claire sat beside the bed. You do not remember everything about Ghost. You recognize the name and the feeling attached to it. Safety. The answer came before he had time to think. Naomi Bell, standing near the window, watched him carefully. That is emotional memory. It can survive even when the brain cannot reliably form new conscious memories. Ethan looked at Claire. Were you Ghost? Claire could have delayed the answer again. There was no clinical benefit in denying what his nervous system already understood. Yes. His shoulders relaxed. How do I know you? I do not know which operation you remember. You said something. What? He closed his eyes, searching a mind that erased the path behind him as quickly as he walked it. Last true thing. Claire felt the old words settle between them. Before she could ask more, 2 hospital administrators entered with Julian Harlow. The taller of them introduced himself as Martin Keene, Director of Clinical Compliance. A military security officer remained outside the glass door. Keene looked at Claire rather than Ethan. Nurse Rowan, we need to discuss your undisclosed operational connection to Colonel Calder. Claire stood. There was no personal connection. He identified you by a classified call sign. I did not recognize him when I entered the room. That does not eliminate the prior relationship. Ethan looked from one face to another. Who are you? Claire immediately lifted the orientation card. Your name is Ethan Calder. You are at Liberty Harbor Medical Center. These administrators are discussing my military history. You are safe. He read the card, then looked at Keene. Why are you discussing her instead of treating me? Miriam Shaw entered behind the administrators. We are treating you. I am reviewing the vascular map now. Keene lowered his voice. Colonel, Nurse Rowan did not disclose that she had previously participated in an operation involving you. We must evaluate whether that affects consent, confidentiality, or clinical judgment. Ethan looked at Claire. Did we have a relationship? No. Did you treat me? I believe I did. You believe? I treated many patients whose faces and names were hidden from me. You never saw mine. Keene opened a tablet. Until the operational history is clarified, Nurse Rowan must step away from direct care. Ethan's heart rate increased on the monitor. Claire saw the change before he fully understood the words. Do not remove the orientation materials, she said. Keep the clock visible. Explain every time he resets. Do not surprise him with memory questions. Beth Lang approached the bed. I can remain with him. Ethan looked at Beth with no recognition. Who is she? Beth Lang. She is the unit supervisor. He turned back toward Claire. And you? Claire Rowan. Ghost? Yes. Keene gestured toward the door. Nurse Rowan. Claire moved one step away from the bed. Ethan pulled the cardiac leads from his chest. Beth reached toward him. He caught her wrist, not violently, but fast enough to stop her. Do not touch me. Beth froze. Colonel, your monitors. Where is she going? Keene answered. She is being temporarily removed while we review the situation. Ethan looked at Claire. Why? Hospital policy. His gaze shifted to the orientation card. He read all 5 lines, then read them again. By the time he reached the bottom, he no longer understood why Claire stood near the door. Who are you? Claire Rowan. Your nurse. Then why are you leaving? The cycle restarted before anyone could answer the first version of the question. Claire stepped closer despite Keene's expression. Ethan, listen to me. You are safe. I am being asked to leave temporarily. Beth will stay. Dr. Shaw is preparing to repair the abnormal blood flow. He shook his head. No. The headache intensified. He pressed both hands against his temples. The superficial veins near his right temple became more visible. Miriam looked at the monitor. His pressure is rising. Keene said, That does not override the review. It may worsen the venous congestion, Miriam replied. Stress raises arterial inflow into the fistula. Ethan stood from the bed. Security moved closer outside the door. His eyes tracked them immediately. You are surrounding me. Claire placed herself between Ethan and the glass wall. Look at me. Ghost? Yes. Last true thing. You are Ethan Calder. You are in a hospital. Your brain is under pressure from abnormal blood flow. Dr. Shaw can treat it. I am alive, and you are not a prisoner. He repeated the final line. You are alive. Then the memory reset again. The door opened behind the administrators. A woman in an Army service uniform entered, carrying a weathered document case. She was in her early 40s, with dark hair pulled into a precise bun and a major's insignia on her shoulders. Major Amelia Ross, she said. Delta Force Medical Liaison and Colonel Calder's designated representative. Ethan stared at her. Do I know you? Yes, sir. But I do not expect you to remember me right now. The answer immediately lowered his suspicion. Amelia looked at Keene. I was contacted about a consent issue involving the designation Ghost. We need confirmation of Nurse Rowan's prior connection to the patient. Amelia placed the case on the counter, then let her remain while I explain it. Removing her is medically destabilizing the colonel and serves no security purpose. Keene hesitated. The operation may still be classified. I am authorized to disclose the medical portions necessary for his care. Miriam nodded toward Ethan's monitor. Do it quickly. Amelia opened the case and removed a redacted report. An old laminated card and a photograph of a rescue team wearing black helmets and respirators. Every face was concealed. Operation Night Quarry occurred 9 years ago, Amelia said. Colonel Calder led a recovery team into an underground weapons facility after intelligence personnel were trapped during a structural collapse. Claire remembered the location before Amelia said another word. Black stone walls. Emergency lamps barely visible through concrete dust. A fractured ventilation shaft filling the lower levels with smoke. The colonel was caught beneath a steel support after a secondary explosion, Amelia continued. He sustained a head injury, a fractured leg, and severe post-traumatic confusion. He remained conscious, but he repeatedly lost orientation and could not retain new information. Ethan looked at Claire. Like now? Yes, she said. Amelia placed the team photograph where he could see it. Nurse Rowan was then Staff Sergeant Claire Rowan, a critical care flight medic attached to a joint recovery unit. Her operational designation was Ghost. Harlow studied the photograph. Why Ghost? She worked in unidentified equipment during covert extractions. No name tape, no visible face, no unit markings. Many patients never knew who treated them. Claire stared at the black respirator covering the medic's face in the photograph. The person in the image looked like someone she had known and buried. Amelia continued. Conditions prevented immediate evacuation. Ghost remained underground with Colonel Calder for 11 hours. Ethan touched the laminated orientation card on his table. Did she make this? The original version, Amelia said. Claire remembered kneeling beside him beneath a damaged support beam. Ethan had awakened every few minutes and demanded the same answers. Who am I? Where is my team? Why can't I move? Who are you? The first several times she answered verbally. Then she realized he needed something that survived longer than each conversation. She tore a waterproof casualty card from her kit and wrote 5 statements. Your name is Ethan Calder. You are under Night Quarry. An explosion injured you. Ghost is with you. Next, we get your team home. Each time he forgot, Claire said. I made him read the card. Amelia nodded. She called it the last true thing method. Ethan's expression tightened as fragments returned without order. Red lights, he whispered. Metal above me. Claire moved closer. You were trapped. I kept asking who you were. Yes. What did you say? Ghost. His eyes closed. And you said not to chase what I forgot. Claire felt the underground air again, hot inside her respirator. I told you to name the last thing you knew was true. Ethan looked at the current card. My name. Yes. You were getting me home. Yes. The recognition did not come from her face. It came from repetition stored deeper than names, from the exact order of facts and the cadence she used whenever panic returned. Keene looked at Amelia. They had no contact afterward? None, Amelia said. Colonel Calder was transferred before Ghost removed her respirator. He never saw her face, and the unit did not disclose her identity. Harlow asked, Then how could he recognize her today? The phrase, Naomi said. The emotional response. The structure of the card. Amelia added. He also spent years searching for her. Claire looked at her. Searching? Amelia removed the old laminated card from the case. The edges were cracked. Dirt remained trapped beneath the clear covering. Ethan's handwriting filled the back in uneven black letters. My name is Ethan Calder. Ghost is getting me home. Ethan reached for the card. His hand trembled as he held it. I wrote this? Yes, Amelia said. You carried it after Night Quarry. When the writing began to fade, you had it sealed. Claire stared at the sentence. She had believed the men she treated remembered only the pain, the confusion, and the faceless medic giving orders in the dark. Ethan had kept proof that she stayed. His attention shifted from the card to Claire. Why didn't I find you? Amelia's expression changed. Months after Night Quarry, Ghost's evacuation aircraft crashed during another operation. Claire became still. 2 members of her crew had died before rescue reached the wreckage. She had survived with burns, broken ribs, and a fractured pelvis, then left the unit before returning to active status. Amelia continued carefully. The operational notice reported the aircraft and Ghost team as lost. The identities and survivor status remained restricted. Ethan looked at Claire. They told me you died. Claire said nothing. They told me Ghost was gone. I left the service after the crash. You let me believe you were dead. I did not know you were looking. His anger surfaced for one clear second. Then his memory failed. He looked down at the old card, confused by the grief already present in his body. Who is Ghost? Claire placed her hand beside the card. I am. He studied her face. You're alive? Yes. The certainty returned beneath the confusion. Amelia looked at Keene. There was no private relationship and no improper contact. The patient recognizes a survival method associated with the medic who kept him oriented during a prior brain injury. Removing her now is clinically harmful. Miriam checked Ethan's monitor. I want Claire present during preparation and treatment. She is the only orientation cue that survives his resets. Keene closed his tablet. She may remain as communication and orientation support. She will not independently obtain consent or direct the intervention. Agreed, Claire said. Ethan read the original Night Quarry card again. This time, he turned it over and found a smaller line written near the bottom. If I forget everything else, trust Ghost. He looked at Amelia. Did I write that too? Yes, sir. Ethan placed the card into Claire's hand. Then don't leave again. Before she could answer, the monitor alarmed. Ethan's eyes fixed on the far wall. His left hand curled inward, and the muscles in his arm began to contract. Another focal seizure. Claire supported him without forcing him flat. Ethan, follow my voice. Your name is Ethan Calder. You are at Liberty Harbor. A vein has started bleeding, and Dr. Shaw is going to stop the pressure. His eyes moved toward her. Ghost? I'm here. Miriam turned toward the procedure team gathering outside. The fistula is no longer waiting for our schedule. We treat it tonight. The procedure team moved quickly, but Miriam Shaw still needed time to choose a route through Ethan's damaged circulation. Closing a dural fistula was not as simple as blocking the brightest vessel on the screen. Several small arteries fed the abnormal connection. Healthy veins passed close to the same area. If Miriam sealed the wrong channel first, arterial pressure could be redirected into vessels already stretched beyond safety. Ethan remained in room 12 while the angiography suite was prepared. The seizure had ended, but his memory resets now came every 3 or 4 minutes. Each time, he opened his eyes to the same unfamiliar hospital. Each time, Claire placed the original Night Quarry card in his hands. My name is Ethan Calder. Ghost is getting me home. The words worked more quickly than the modern orientation sheet. Ethan did not consciously remember writing them, but his body responded as though the card carried proof older than confusion. Last true thing? Claire asked. He looked at the faded handwriting. Ghost stayed. The answer pulled both of them 9 years into the past. Night Quarry had been buried beneath an abandoned mining complex in a country Claire was never permitted to name. Ethan's Delta Force team entered through a freight tunnel after intelligence officers became trapped below ground. The first collapse blocked the main exit. The second explosion dropped a steel support across Ethan's legs and drove his helmet against the concrete floor. Claire reached him 20 minutes later wearing black armor, sealed goggles, and a respirator that hid every part of her face. Ethan was conscious. He knew his rank. He knew the names of every man on his team. Then, 4 minutes later, he asked where he was. Claire explained the collapse. He listened carefully. 5 minutes later, he accused her of capturing him. She explained again. By the 6th repetition, Ethan understood that his mind was failing to preserve anything she told him. "What is my name?" he demanded. "Ethan Calder." "Who are you?" "Ghost." "What happened?" "An explosion injured you." "Where is my team?" "Moving toward the east extraction shaft." "Why am I still here?" "Because 6,000 pounds of steel are lying across your legs." He looked down as though seeing the beam for the first time. Then his eyes returned to her respirator. "Who are you?" Claire realized verbal reassurance would vanish as soon as the question ended. She removed a waterproof casualty card from her medical pack and wrote 5 statements. "Your name is Ethan Calder. You are under night quarry. An explosion injured you. Ghost is with you. Next, we get your team home." She placed the card inside his glove. "When the room changes, read it." "What do you mean when the room changes?" "When you stop knowing why I am here." "I know why you are here." "Read it anyway." Minutes later, Ethan woke into the same moment as though it were new. His hand reached for the weapon that was no longer attached to his vest. Claire caught his wrist. "Read the card." He looked down. The words restored the structure of the world. "My name is Ethan Calder." "Yes." "You are Ghost." "Yes." "You are getting my team home." "That is the next true thing." The rescue lasted 11 hours. Hydraulic equipment could not reach the lower level. Every time the damaged structure shifted, dust filled the tunnel and Ethan's headache worsened. He vomited twice. His pupils remained reactive, but his attention disappeared in waves. Then the first seizure began. His right arm drew inward. His eyes fixed toward the broken ceiling. The movement lasted less than 30 seconds. But afterward, he could no longer remember how long he had been trapped. The remote physician advised treating it as a concussion and continuing the extraction. Claire disagreed. She saw the slowing pulse, repeated vomiting, and worsening confusion. She elevated Ethan's head as much as the steel allowed, protected his airway, and altered the fluid plan to avoid increasing pressure inside his skull. When a rescue engineer suggested sedating him heavily to make the extraction easier, Claire refused. "If he stops answering, we lose the only warning that his brain is changing." For the remaining hours, she tested him after every reset. Name, Ethan Calder. Location, night quarry. Who is with you? Ghost. What happens next? We get my team home. By the time the steel was lifted, Ethan could no longer lift his left leg. Claire stabilized his breathing, maintained his blood pressure, and accompanied him through the extraction tunnel while he held the card against his chest. He asked who she was 17 more times. She answered every time. At the aircraft, another medical team took control before Claire removed her helmet. Ethan never saw her face. He remembered only the respirator, the black goggles, and the last sentence written on the card. "Ghost is getting me home." Months later, Claire's evacuation aircraft crashed during a night approach. The impact killed the pilot and another medic before the wreckage stopped moving. Claire survived beneath a broken equipment rack with fractured ribs, a crushed pelvis, and burns along her shoulder. Rescue teams reached her hours later. Her operational unit was dissolved during the investigation. The official notice listed the aircraft and Ghost team as lost. Survivor identities remained restricted. Claire spent almost a year in rehabilitation. When she was physically cleared to return, she declined. She left the service without learning that Ethan Calder had carried the old card through every assignment that followed. In room 12, Ethan traced the damaged edge of that same card. "They told me you died." His voice held certainty for only a moment. Then his expression emptied. He looked around the room. "Where am I?" Claire opened the notebook. "Your name is Ethan Calder. You are at Liberty Harbor. A damaged blood vessel is putting pressure on the parts of your brain that form memory. Dr. Shaw is preparing to repair it." Ethan read the entry, but the words took longer to connect. He pointed to a line near the bottom. "Who is Sophie?" Your daughter. He stared at the photograph beside her name. No emotional response came this time. Claire felt the change immediately. Earlier, Ethan had not recognized Sophie, but his body understood that she mattered. Now, even that connection seemed harder to reach. Naomi Bell entered with a simple picture test. She showed him a key, a chair, and a clock. Ethan named all three. 2 minutes later, she showed the same objects. He recognized the key. He called the chair a table. He stared at the clock without speaking. What is it used for? Naomi asked. Ethan's hand moved uncertainly in the air. To measure distance. Claire looked toward Harlow. The deterioration had moved beyond forgetting events. The congestion was beginning to interfere with basic meaning. Ethan attempted to write in the notebook. He held the pen upside down. Claire corrected it gently. You write with this end. He looked at the pen as though she had handed him a surgical instrument. I know how to write. I know. He positioned it properly, wrote the first letter of his name, then stopped. Nausea struck without warning. Claire turned him onto his side as he vomited. His left arm failed to support him, and his hand slid from the mattress. Ethan, squeeze my fingers. The right hand responded. The left barely moved. Miriam entered with the newest MRI displayed on a portable monitor. The swelling around both hippocampi had increased. The thalami appeared brighter and more congested. Beside the first venous leak, a second area of blood had developed. Small, still contained, but new. The fistula is accelerating, Miriam said. The pressure is recruiting deeper drainage pathways. Harlow studied the scan. How much function is threatened? Memory, language, attention, motor control, and consciousness. If the deep veins infarct, he may not wake. Ethan looked between them. Have I agreed to surgery? Claire opened the notebook to the signed consent summary. You agreed during a period when you understood the risks. Major Ross also confirmed the decision as your military representative. What are the risks? Miriam answered as though it were the first time he had asked. Stroke, brain hemorrhage, seizures, permanent worsening of memory, coma, death. And without it? The pressure continues until a vein ruptures or the tissue loses blood flow. Ethan looked at the original card. Ghost. I'm here. Did I trust you before? Yes. Should I trust her? He pointed toward Miriam. Yes. Ethan nodded. Then do it. The angiography team arrived with the transport stretcher. Claire placed both orientation cards and the notebook inside a clear bag that would travel with him. As they entered the corridor, Ethan's eyes closed. His body became heavier against the mattress. Ethan? He opened them slowly. The left arm no longer lifted when Claire asked. Miriam checked the newest images one final time while the procedure doors opened. The fistula fed into a diseased section of venous sinus, but several normal veins still used nearby channels to drain the brain. Closing the abnormal connection required exact order. Arteries first, dangerous reflux second, healthy drainage preserved throughout. Miriam looked at Claire, Harlow, and the team waiting beneath the angiography lights. If we close the wrong vein first, the pressure will have nowhere to go except through his brain. The angiography room was arranged around a danger no one could see from the outside. Ethan lay beneath the imaging equipment, with his head secured in a neutral position and his left arm resting weakly beside him. Claire stood near his right shoulder, outside the sterile field, holding the original Night Quarry card where he could see it. The faded words had survived 9 years. My name is Ethan Calder. Ghost is getting me home. Miriam Shaw stood beside the monitors in a protective apron. The cerebral angiogram from earlier had been reconstructed into a detailed map of arteries, veins, and the diseased section of sinus between them. 3 arterial branches visibly fed the fistula. Several smaller vessels might be hidden behind the strongest flow. Normal veins still entered the same region. Miriam could not simply fill the sinus and hope the abnormal pressure stopped. If she blocked the healthy exit before closing the arterial supply, blood would continue entering Ethan's skull with nowhere safe to leave. The anesthesiologist adjusted the medication line. We will begin with light sedation, he said. He may drift in and out. Claire looked toward Ethan. You may wait confused. The card will stay in your hand as long as possible. I will repeat the facts every time. He studied her face. Have you told me that already? Twice. Did I believe you? You asked me to keep telling you. Ethan looked down at the notebook entry confirming the decision. I agreed to the procedure. Dr. Shah will close the abnormal blood flow. Ghost will stay. He nodded. Last true thing? Claire answered. You chose treatment. Miriam approached the table. Colonel Calder, I am entering through the artery in your right groin. I will guide a catheter toward the small vessels feeding the fistula. We will test each branch before closing it. Closing it with what? A liquid embolic material. It travels through the catheter and hardens inside the abnormal vessel. Can it go somewhere else? Yes. That is why we move slowly. Have I asked that? Once. Ethan looked at Claire. She is telling you the truth, Claire said. Then continue. Local anesthetic entered near the groin. Miriam placed the arterial sheath and advanced a catheter through the aorta toward the vessels supplying the right side of Ethan's skull. Contrast illuminated the first arterial branch. Blood raced through the middle meningeal artery and entered the fistula almost instantly. The venous sinus filled far earlier than it should have. From there, pressure traveled backward into enlarged veins around the temporal lobes and deep structures. Miriam selected the largest feeder. Microcatheter advancing. The thin device moved through increasingly narrow branches. Each turn brought it closer to the abnormal connection and farther from any route that would allow easy correction if something went wrong. Harlow watched from the control area with Naomi Bell and Major Amelia Ross. Pressure readings? He asked. A technician compared arterial and venous measurements. The diseased sinus is significantly elevated. How elevated? Nearly arterialized. High-pressure blood had transformed a drainage channel into a second artery. Miriam stopped the catheter before the fistula and injected a tiny test dose of contrast. A normal branch appeared nearby. It traveled toward the membrane surrounding a cranial nerve. If embolic material enters that branch, he could develop facial weakness, Miriam said. Can you pass it? Harlow asked. I have to advance beyond the origin. The catheter moved another 2 millimeters. Ethan shifted beneath the drapes. His eyes opened. He stared at the ceiling, then at the unfamiliar people surrounding him. His heart rate climbed. Where am I? Claire immediately brought the card into view. Your name is Ethan Calder. You are at Liberty Harbor Medical Center. A damaged connection is forcing high-pressure blood backward through the veins around your memory centers. Dr. Shaw is repairing it. I am Claire. Ethan looked at her without recognition. She added the name stored deeper than the others. Ghost. His breathing slowed. You're getting me home. Yes. Miriam waited until the pressure stabilized. Beginning first embolization. The liquid material entered the feeder as a dark line on the live image. It moved slowly through the abnormal artery, approaching the point where arterial blood crossed directly into the venous system. Miriam paused repeatedly, allowing it to harden before advancing more. The dangerous flow from the first branch weakened, then stopped. First feeder closed. A new angiographic run showed less blood entering the fistula, but the veins remained congested. Pressure decreased 12%, the technician said. Harlow looked at Miriam. Only 12? The other feeders are carrying more now. When one route closed, blood redirected through the remaining channels. Miriam selected the occipital artery branch. It was narrower, longer, and more irregular than the first. Claire tested Ethan while the catheter advanced. Tell me your name. He looked at the card. Ethan Calder. Where are you? Liberty Harbor. Who am I? Claire Rowan. She waited. His eyes returned to her. Ghost. Good. Lift your right hand. He did. Left hand. The fingers moved, but the arm barely rose from the table. The weakness had worsened before the procedure began. Claire recorded the response on a sheet where every change could be compared minute by minute. Miriam reached the second feeder. A test injection revealed no normal cranial nerve branch nearby. Safe position, she said. Beginning embolization. The second arterial channel filled with dark material. The abnormal flow decreased again. For several seconds, the venous pressure began to fall. Then the pattern changed. A deep vein that had appeared only faintly on the earlier angiogram suddenly brightened. Blood entered it from the opposite direction. Miriam stopped immediately. New reflux? Harlow leaned toward the monitor. Where? Deep medial drainage. It was hidden by the dominant flow before. The technician checked the pressure. Rising again. How can it rise after 2 feeders are closed? Claire asked. The remaining pressure has found a smaller route, Miriam said, like closing 2 exits while leaving the strongest pump running. She injected contrast through another artery. A third known feeder appeared. Behind it, something else filled the diseased sinus from an angle the first mapping had not shown. Miriam studied the delayed images. There may be another connection. Ethan's eyes opened again. He looked directly at Claire but showed no recognition. Why can't I move? You have weakness in your left arm from the pressure in your brain. What pressure? She repeated the 5 facts. He listened, then forgot before she finished. Who are you? Claire. His breathing accelerated. Ghost, she added. The fear softened, but only slightly. Miriam advanced toward the 3rd feeder. We need to reduce the arterial inflow before the deep vein fails. The catheter passed through a tortuous branch. Each pulse moved it against the vessel wall. Do not move, Claire told Ethan. He looked at her. Why? Because a catheter is inside a small artery near your brain. His expression changed from confusion to disciplined control. The body remembered how to obey during danger, even when the mind could not preserve the explanation. Miriam reached the feeding point and began the 3rd embolization. The abnormal flow slowed. The deep venous pressure fell briefly. Then Ethan's right hand clenched around the orientation card. His eyes shifted toward the left. Ethan? Claire said. He did not answer. The muscles in his right arm contracted rhythmically. His left side remained motionless. Focal seizure, Harlow said. The anesthesiologist administered medication. Ethan's jaw tightened. His breathing became irregular, and the seizure spread from his hand into his shoulder. Claire kept her voice close to him. Your name is Ethan Calder. You are in the hospital. Ghost is with you. His eyes moved toward her voice. Stay with the last true thing. The seizure stopped after 42 seconds. Ethan opened his mouth. No words came. Tell me your name, Claire said. His lips moved again. Only an indistinct sound escaped. Language deficit, Harlow said. Claire tested his movement. Lift your right thumb. It moved. Left thumb. Nothing. Look toward me. His eyes found her slowly. Miriam ordered an immediate angiographic run. The major arterial connection was nearly closed, but the small deep vein had become intensely congested. A monitor beside the table displayed a rapid cone beam CT. A new spot appeared near the right thalamus. Small, dark, blood. New hemorrhage, Miriam said. Harlow stared at the image. Expanding. Not yet. Claire looked toward Ethan. Can he understand us? Naomi spoke from the control area. Test recognition without relying on speech. Claire placed the old card in his right hand. Ethan stared at it. His eyes moved across the familiar lines, then stopped at the word ghost. His fingers tightened around the card. Ethan, squeeze once if you understand me. 1 squeeze. He was still inside the confusion. Still listening. Miriam reviewed the full angiogram again. The 3 known feeders were nearly sealed, but contrast continued appearing within the venous sinus. It did not enter from the route she expected. She rotated the imaging system and injected from a smaller artery behind the ear. A hidden channel appeared along the posterior wall of the sinus. It crossed directly into the venous system behind the first fistula point. A second connection. Narrow, difficult to reach, still carrying enough arterial pressure to force blood backward into Ethan's deep veins. That was concealed by the original shunt, Miriam said. Can you close it from the arterial side? Harlow asked. The route is too small and too close to a normal branch. I may need to reach it through the venous system. The hemorrhage remained stable, but Ethan's left side did not move. His speech had not returned. His memory could no longer hold even the complete 5-line orientation sequence. Claire reduced it to 1 sentence. You are Ethan. Ghost is here. His right hand squeezed hers. Miriam looked at the hidden passage still feeding the brain under pressure. The first connection was closed. The blood was still flowing backward. Miriam Shaw could not reach the hidden connection from the arterial side without risking a normal vessel that supplied the tissues behind Ethan's ear. The remaining option was to approach the fistula from the opposite direction. through the veins. She withdrew the arterial microcatheter far enough to secure it, then ordered a second access line prepared in Ethan's left groin. "We will enter the venous system, travel upward through the jugular vein, and cross the diseased sinus from below," she explained. "The path is narrow and partly reversed by the abnormal pressure." Julian Harlow studied the angiographic map. "Which veins are still draining normally?" "Several cortical veins enter near the fistula. The deep system is draining backward through a smaller channel toward both thalami. And if you block that channel, the pressure could rise instantly in the center of his brain." Claire looked at Ethan. His eyes were open, but his expression no longer showed that he understood the room. His right hand remained wrapped around the old night quarry card. His left arm lay motionless against the table. She leaned close. "Your name is Ethan Calder. You are at Liberty Harbor Medical Center. A damaged connection is forcing blood backward through your brain. Dr. Shaw is reaching the last part now." He stared at her. No recognition. "I'm Claire." Nothing changed. "Ghost." His fingers tightened around the card. The name still reached him. Miriam placed the venous sheath and advanced a catheter into the left internal jugular vein. On the screen, the root curved upward toward the sigmoid sinus. The vessel narrowed before the diseased segment. "Chronic remodeling," Miriam said. "The high-pressure flow has distorted the channel." The guide wire entered the narrowing and stopped. She changed the angle. The wire bent against the wall. "Do not force it," Harlow said. "I am not." Ethan's heart rate rose. Claire touched his right wrist. "You do not have to remember everything. You only need the next minute." His eyes shifted toward her voice. "Who are you?" he asked, the words thick and incomplete. "Claire Rowan." He continued searching. She gave him the name that required no explanation. "Ghost." His breathing slowed. Miriam selected a softer wire and advanced again. The tip crossed the narrowed segment and entered the transverse sinus. Through. The catheter followed. Contrast showed the remaining abnormal connection from the venous side. High-pressure arterial blood entered through the hidden opening and immediately reversed into the deep veins. Miriam marked 3 structures on the monitor. "The fistula point is here. This larger channel is diseased sinus and can be sacrificed. These 2 smaller veins are still draining normal brain." She looked toward the team. "I have less than 3 millimeters between closing the fistula and blocking healthy drainage." Harlow's voice lowered. "And the thalamic vein?" "Entering from behind. I cannot see its opening clearly because the flow is reversed." "Can you test it?" "Only by temporarily reducing the shunt and watching where the blood goes." Miriam inflated a small balloon inside the diseased sinus. The abnormal flow slowed. For several seconds, the deep veins began draining in the correct direction. Then, one of the normal cortical veins stopped filling. "Balloon too proximal," she said. She deflated it immediately. The vein reopened. Another 2 millimeters forward. A second inflation. This time, the cortical veins remained open, but the hidden fistula continued filling around the balloon's edge. Too distal. The safe space existed somewhere between those 2 positions. Ethan's right hand began trembling. Claire watched his face. "Ethan, look at me." His eyes found her but did not remain. "Last true thing," she said. He whispered, "Don't know. That is all right. I will give it to you. Your name is Ethan Calder." His lips repeated the name. "You survived night quarry." A pause. Ghost stayed. His fingers pressed into hers. "Yes." Miriam repositioned the balloon between the 2 previous points. Third test. The balloon expanded. The fistula flow nearly disappeared. Both cortical veins remained open. The deep thalamic veins began draining away from the brain instead of toward it. "That is the position," Miriam said. Preparing embolic material. Ethan looked at Claire again. "Why can't I move my arm?" "Pressure and a small bleed affected the right side of your brain." "Will it come back?" "We do not know." "Who are you?" The question returned before the answer could settle. Claire did not show frustration. "I'm Claire." His eyes remained afraid. "Ghost." Recognition softened his face. "You're alive." "Yes." "For how long?" "As long as this takes." Miriam advanced a microcatheter through the balloon and placed its tip at the hidden fistula opening. "Beginning venous embolization." The material entered the diseased sinus as a dense shape on the screen. Miriam released it slowly, building a barrier directly across the abnormal connection while preserving the openings of the healthy veins. The arterial flow weakened, then redirected toward a second narrow channel. "Residual shunt," the technician said. Miriam stopped. A thin branch still carried blood around the developing plug. "If I fill farther, I may cover the thalamic drainage point. If you stop, the fistula remains active," Harlow said. "I know." The venous pressure increased by several points. Ethan's eyes fixed on the ceiling. His right hand stopped responding. Claire tightened her fingers around his. "Ethan, squeeze." "Nothing. Move one finger." No response. The anesthesiologist checked the medication. Sedation has not changed. Harlow watched the neurological trace. "Possible seizure?" "No rhythmic activity," the technician said. Claire moved closer to Ethan's face. "You are Ethan Calder. Ghost is here." His eyes shifted slightly. "Remember me for one more minute." His lips moved. No sound came. She repeated it. "One more minute, that is all." His right index finger pressed against her palm. Miriam saw the movement. He is still following commands. She studied the residual channel. The opening curved behind the plug, close to the dangerous deep vein. "I need a smaller catheter." A microcatheter thin enough to enter the residual passage was passed through the first device. Miriam advanced it by fractions of a millimeter. The tip entered the channel. A test injection showed the abnormal connection without filling the normal thalamic vein. Safe position. She delivered the final amount of embolic material. The residual channel darkened. Flow slowed, then stopped. Miriam waited before repeating the angiogram. The first injection showed no early venous filling. She tested another artery. No shunt. A third. Still none. The fistula is closed. No one celebrated until the venous phase appeared. Blood from the temporal lobes moved into the sinus in the correct direction. The cortical veins remained open. The deep veins around the hippocampi and thalami began emptying normally for the first time in nearly 2 weeks. "Deep drainage restored," Miriam said. The venous pressure fell. The small hemorrhage near Ethan's right thalamus did not enlarge. Claire felt his finger move again. "Ethan?" His eyes opened. "Ghost. I'm here. Did it work?" "Yes." "The abnormal connection is closed." He stared at her. Then the memory reset. "Where am I?" She held the old card in front of him. "Liberty Harbor Medical Center." "What happened?" "Your brain could not drain properly. Dr. Shaw repaired the blood flow." "Who are you?" "Claire Rowan." He looked at her without recognition. She said the other name. "Ghost." His grip tightened. "You're getting me home." "Yes." The team removed the catheters and transferred Ethan to the neurological intensive care unit. He remained sedated for several hours to control his blood pressure and protect the repaired vessels. The first follow-up scan showed no new hemorrhage. The deep veins were smaller. Swelling around the hippocampi and thalami remained, but it had stopped increasing. His left arm still did not move normally. His speech returned before stable memory did. When the sedation was reduced, Ethan opened his eyes and looked at the ceiling. Claire stood beside the bed with the orientation card ready. "Your name is Ethan Calder." He looked toward her. "Do I know you?" "Yes." "How?" "You knew me as Ghost." His face relaxed. Then he looked at the notebook, the hospital room, and the monitor, as if each object belonged to a different life. Harlow entered during the examination. "Colonel Calder, the fistula has been closed. Your brain is draining in the correct direction." Ethan listened. 5 minutes later, he asked Harlow why he was in the hospital. Harlow answered again. He did not refer to the repetition as agitation. He did not test Ethan before orienting him. He explained the same facts in the same order Claire had used. Afterward, Harlow stood near the foot of the bed. "We interpreted progressive neurological deterioration as psychological resistance," he said. "We treated your fear as behavior instead of recognizing that every few minutes you were waking into a room you could not understand." Ethan read the sentence Claire had added to his notebook. "The fistula is closed. Memory recovery may take time." "Did you almost send me to psychiatry?" he asked. "Yes." "Because I kept forgetting?" Because we believed the forgetting could not be treated. Ethan looked at the notebook again. You were wrong. Yes. The hospital review began before Ethan left intensive care. Progressive amnesia after trauma could no longer be assigned to psychiatric transfer without reconsidering vascular causes. Pulsatile tinnitus, positional headaches, seizures, and symmetrical deep brain swelling required venous imaging. Patients with memory failure received orientation boards, visible clocks, written timelines, and consistent staff introductions. Recording confused patients without consent became a disciplinary violation. Beth Lang removed the phrase, behavioral problem, from Ethan's nursing plan. She replaced it with, patient requires repeated orientation because new memory formation is impaired. Approach calmly. Explain before touching. Do not test before orienting. Hours after the procedure, Ethan woke again. Claire lifted the orientation card. Before she could begin, he looked directly at her. What was the last true thing? You survived, Claire said. Ethan studied her face as though the answer were incomplete. No, he whispered. Ghost came back. The words were quiet, but they were new. For the first time since the procedure, Ethan had connected something that happened before the embolization to the person standing beside him afterward. The memory was fragile. It might last seconds. It might disappear before Claire could document it. She opened the notebook and wrote the time. 9:14 a.m. Ethan remembered that Ghost returned. He watched her finish the sentence. Will I remember writing that? You did not write it. Will I remember you writing it? I don't know. Ethan looked toward the clock on the wall. Then ask me later. 10 minutes passed. Harlow completed a neurological examination. Ethan's left hand could close weakly around 2 fingers. His speech remained slow, but each word was clear. He still needed the orientation card to identify the hospital and understand why his groin had been bandaged. Claire waited until the clock changed to 9:24. What happened 10 minutes ago? Ethan looked at the notebook. She closed it before he could read. His expression tightened. You wrote something. What? That I remembered you. Claire felt hope rise and immediately forced it into restraint. What exactly did you remember? That Ghost came back. The memory had remained for 10 minutes. It disappeared before lunch. When Ethan woke from a short sleep, he did not recognize the room, the procedure, or Claire's face. The name Ghost still calmed him, but the conversation from the morning was gone. Recovery did not move in a straight line. During the first week, Ethan retained new information for 15 or 20 minutes on good days. On difficult mornings, the resets returned after 5. He remembered that the fistula had been closed but forgot when. He learned Miriam Shaw's name 3 times, lost it twice, and recognized her voice before he could place her face. The strength in his left arm improved steadily. Memory moved more slowly. Claire expanded the last true thing system beyond one card. A large board beside the bed listed the date, location, diagnosis, and daily plan. A digital tablet displayed photographs of every clinician with names and roles beneath them. Ethan's notebook contained a timeline written in simple language, with each entry signed by the person who added it. Nothing depended on him pretending to remember. Naomi Bell tested his memory without turning recovery into humiliation. She gave Ethan a short story, waited 10 minutes, and asked him to repeat it. At first, only 1 detail survived. Then 2. Weeks later, he remembered the beginning and ending but placed them in the wrong order. Procedural memory remained his strongest system. He learned a new hand exercise and performed it correctly the next day despite insisting he had never seen it. He could follow a rehabilitation route through the hospital while forgetting why he had entered the hallway. Your brain is still learning, Naomi explained. The problem is reaching the memory consciously. Ethan looked at the exercise band in his hand. So part of me knows more than I do. That has been true since the first day. The swelling around his hippocampi and thalami began decreasing on follow-up scans. The deep veins no longer appeared enlarged. Miriam repeated the angiogram 3 months after treatment and found no recurrent fistula. The repair is holding, she told him. Ethan looked at Claire. Have I met her? Several times. He faced Miriam again. Then I'm sorry if I ask the same questions. You don't need to apologize for your brain recovering. I prefer to apologize before I forget whether I did. Miriam smiled. The fistula remains closed. That is the answer I will give every time. Some memories never returned. Ethan could not recover the 12 days between the training blast and the procedure. Large portions of his final years in command remained fragmented. He knew his daughter Sophie, but certain recent conversations with her were gone. The first time she visited after he could retain an entire afternoon, she brought photographs and sat beside him without demanding recognition. Ethan studied one picture showing them on a fishing boat. I remember the lake. Sophie's eyes filled. That was last summer. I remember the weather. I remember being annoyed that you forgot sunscreen. You made me wear your hat. He looked at her. I don't remember giving it to you. That's okay. No, it isn't. Sophie placed the photograph in his notebook. It can still be ours even if I remember more of it. Ethan held her hand for the rest of the visit. He remembered that part the next morning. After 6 weeks, Ethan retained an entire morning. After 3 months, he could carry most new memories through a full day. By the 5th month, he began describing events from the previous week, without checking his notebook first. He continued using written reminders, alarms, photographs, and recorded messages. Structure was not evidence of failure. It was the bridge allowing damaged memory systems to work with the ones that survived. Claire developed the same approach into a hospital protocol. Patients with severe disorientation received orientation before testing. Staff introduced themselves during every interaction without demanding that the patient remember them. Visible timelines replaced repeated surprise questions. Personal objects, photographs, and trusted voices were treated as medical supports rather than sentimental distractions. The neurological protocol changed as well. Progressive amnesia after trauma could not be closed as psychological when accompanied by positional headaches, pulsatile tinnitus, seizures, or unusual symmetrical swelling in the deep brain. Venous imaging became part of the evaluation for atypical cases. Beth Lang asked to speak with Ethan before his discharge. She entered the room, identified herself, and waited while he checked her photograph on the staff board. You were the nurse who assigned me to Claire. Yes. As a joke. Beth did not defend herself. Yes. Ethan looked toward Claire, then back at Beth. I don't remember it. I do. Then why apologize to me? Because forgetting what I did does not erase what it revealed about us. We saw your confusion as inconvenience. We expected the new nurse to fail because no one wanted to admit we had already failed you. Ethan considered the answer. Did you change anything? Beth showed him the new orientation kits used throughout the unit. That is a start, he said. Julian Harlow added venous imaging criteria to the hospital's neurological guidelines. He also removed phrases such as refuses reality and behavioral resistance from Ethan's early records, replacing them with descriptions of what had actually occurred. Patient repeatedly awakens without retained context. Patient becomes defensive when approached before orientation. Patient responds to structured reassurance and familiar emotional cues. The rewritten notes could not change the treatment Ethan almost received. They could stop the same assumptions from following him forever. Major Amelia Ross returned carrying a rigid protective sleeve. Inside was the original Night Quarry card. Claire expected her to give it to Ethan. Amelia placed it in Claire's hands. He requested that you keep the original. When? 4 months ago. Claire looked at Ethan. Do you remember asking that? He thought for several seconds. No. Do you still want me to keep it? Yes. How can you be sure? Because apparently I make good decisions even when I can't remember making them. He gave her a newly laminated card. The handwriting was steadier than the lines from Night Quarry. My name is Ethan Calder. Today is Friday. Claire Rowan is Ghost. I will remember tomorrow. Claire read the final line. That sounds confident. It's an order. Brains don't follow rank. Mine has ignored enough of them. A year after the embolization, Ethan returned to Liberty Harbor for another angiogram. The fistula remained closed. The deep veins drained normally. His memory was not perfect, but he arrived knowing the appointment date, Miriam's name, and the reason for the scan. Afterward, he met Claire in the hospital cafe. She placed 2 cups on the table. What did we do last Friday? She asked. Ethan did not reach for his notebook. We met here at 10. You ordered coffee and complained that it tasted burned. It did. You said that every hospital cafe uses the same coffee as punishment. That sounds like me. You asked whether I regretted leaving the service. Claire waited. What did I answer? You said you regretted disappearing, but not surviving. He remembered the conversation. The table. The drinks. Her answer. The promise he made to return. Ethan smiled and placed the new card between them. I told you I would remember tomorrow. You were a few months late. But I remembered. Later that afternoon, another veteran arrived at Liberty Harbor with worsening forgetfulness after a head injury. His previous records listed PTSD, anxiety, and poor cooperation. He reported headaches that became worse when lying down, and a pulse-like sound behind one ear. No one arranged psychiatric transport. Beth dimmed the room, placed an orientation card in his hands, and called neurology. Harlow ordered arterial and venous imaging before asking the patient to prove anything about his memory. Claire entered and sat where he could see her. Don't chase what you forgot, she said. Tell me the last thing you know is true. Ethan had spent months losing every day. The first future he kept began with the name Ghost.